office. She's watching right now.
What is your message to this mother? Will you or anyone from your government reach out to her? And should a parent in this province feel so defeated by the system that they feel that they have to take such extreme measures to camp out outside your office just to get help for their child?
Sure. First of all, my heart breaks for Stacey and all families that have autistic children. Actually, Stacey did talk. She's from Oakville. She did talk to her MPP out there, and I know my office talked to her. But I have no problem talking to Stacey, as I do with hundreds and hundreds of people on a weekly basis. Colin, I want to remind you, I'm one of the only premiers in the history of this country that gives out a cell number. I talk to the average common folk every single day, and I'm going to continue doing it. And Stacey, I will make sure that we reach out to you, have a good conversation, see how I can help you. And let's remember, when I took office, the autism file was an absolute disaster, like a complete disaster. Since then, we have doubled the funding for the autism community per se, and help them out. And we're going to continue to help them. My heart breaks for those folks, but we're going to be there. And Stacey, I'll be able to give you a call.
Hi, Premier. Alison Jones with the Canadian Press.
Hi, Alison.
On vaccine certificates, now everybody, except perhaps employees, are going to be vaccinated in these businesses. Are you considering lifting or raising capacity limits at all, perhaps as an incentive for businesses to enforce this measure and as a way for them to get more revenue?
Yeah, well, I'm going to follow the advice which I have from day one from the Chief Medical Officer and the science table, and we have these discussions almost on a daily basis. I know the Minister of Health has these discussions as well. And have I been cautious? Sure, I've been cautious. But look where we are with 15 million people per 100,000, lowest cases anywhere in North America for regions our size outside of the Atlantic bubble. And we just want to make sure that we can always move forward and not backwards, make sure that we can continue expanding on capacity limits, but saying that, do it cautiously, and make sure that we have the backs of our businesses, which we have, and they get back on their feet. So I'm going to follow the advice of the Chief Medical Officer and continue cautiously, working with him and having a few more people go into restaurants, other locations.
Thanks. And on a different topic, now that the federal election is done, are you going to be resuming discussions with the federal government on a childcare deal? And what was the issue? What were the sticking points before? Why weren't you able to reach an agreement before the election?
We had some great conversations with the federal government, myself, our ministers. We want a deal. We want to make sure we have the right deal for Ontario. And even with the discussion with the Prime Minister, there's a lot of people in Ontario that supported the Prime Minister. And now it's time for the Prime Minister. He made a lot of promises to support the people of Ontario. And make no mistake about it, I'm going to be right in the front line of making sure that all those promises he's committed to, he fulfills them. And I'm going to work with him collaboratively in a good way, not in a bad way, but a good way. But my number one priority over anything is protecting the people of Ontario, making sure that their interest comes first.
Hi, Premier. It's Richard with 680 News.
Hey, Richard.
You said again today that the vaccine certificate program is just going to be a temporary measure.
Sure.
Can you tell us today, Premier, what specific criteria you will look at to decide when this program ends?
Well, the criteria is going to be based on the advice I get from the Chief Medical Officer and the science table. But there's no secret. I was reluctant. I was reluctant because I just don't believe in government dictating to people how to live their lives, run their businesses, and saying that this is a special circumstance. This is a special circumstance that the whole world has faced, and every premier in this province. So I want to, move forward with this, but I don't want to do it a day longer than we have to. So I can't give you the exact date, Richard, but hopefully it'll be sooner than later.
Premier, the Independent Financial Accountability Office recently said that your government didn't spend any of the $2.7 billion COVID response transfer payment in the April to June fiscal first quarter. Critics were quick to point out that could have been money used to, among other things, make classrooms smaller. Can you tell us why that money wasn't spent, sir?
Well, that was a snapshot in time, and make no mistake about it, we're going to be spending every single penny of what we've received. And again, there's no secret that we've spent billions and billions of dollars supporting the people of Ontario, supporting the businesses, supporting the healthcare system. We're going to continue doing that. There won't be a penny left on the table when it comes to the pandemic. I think I've shown the people of this province I have not spared a penny. I want to make sure that the money goes to the right areas allocated to the appropriate people.
Hi, Premier. Matthew Bingley from Global News.
Hi, Matthew. How are you doing?
Well, municipalities are already saying that they're going to be bearing the brunt of expenses when it comes to enforcing the vaccination certificate program. Mayor Patrick Brown has already said that, pointed to the Liberals' promise of spending $1 billion on helping provinces with this. Would you be willing to reach out to the federal government, get some of those funds to direct to municipalities? And what about businesses who are talking about the same problem?
Yeah, well, the municipalities, you know, we've supported them from day one, and so has the federal government. We've given municipalities over $5 billion, 4+1, and we've supported Brampton and other regions around the province really, really well. I appreciate what Mayor Brown is saying, but again, you know, we're going to be there for them, and I can't say specifically. I'll try to get every single penny I can off the federal government and allocate it to the appropriate places. I just want to remind everyone, it was the Restaurant Association of Canada, it was the Ontario Chamber of Commerce, Toronto Chamber of Commerce, everyone and their cousin and their brother was on to me about getting the certificate, and so we move forward with it. And let's see. I just ask the people of Ontario, please be patient. Again, you know, 85% have their first doses, 80% or close to it have their second doses, and I truly believe in the people of Ontario. They're going to do the right thing. I don't think there will be any incidents, and I hope there won't be. We're just going to move forward on this, and we aren't going to do it for a day longer than we have to.
You said a moment ago that you didn't want to get in the way of the federal election.
That's right.
The election was Monday. Yep. You've prorogued the legislature until October 4th. Mm-hmm. That's 2 weeks from now. Why not recall it now so you can get back to work here?
Well, we're continuing to work, and I just have to remind you and the people of Ontario, we had one of the longest sitting parliaments in recent memory. I can't remember the last time any government had sat as long as we did, and we're going to continue to do that and move forward and passing bills that will protect the people of Ontario, protect businesses, and get us back on our feet. And I want to give another shout out. I can't give more of a shout out to the people of Ontario that have really shown the Ontario spirit, have helped out, and our frontline healthcare heroes. They've been magnificent. They've been working around the clock to get us through this. So we'll continue doing it, and we're going to get into the House as soon as we can.
This will be our final reporter.
Hi, Premier. Jack Cowan from QP Briefing.
Hi, how you doing?
Good.
Good, Jack.
How are you?
Good.
Good. Will you commit that all of your 2022 candidates are going to be vaccinated unless they have a medical exemption? And if so, can you spell out exactly what those exemptions will look like?
Well, all our candidates are going to be they're going to be vaccinated. They just aren't running for our party. As simple as that. And you know, our caucuses, to the exception of one medical exemption, and we're going to move forward. I can't be up here preaching to get vaccinated, and our own team isn't vaccinated. So as of right now, every single candidate that's running for the PC party has been vaccinated and will be vaccinated, or they won't be running for our party. It's about as clear as day.
Thanks. And I wanted to switch gears and ask you about a different health epidemic, the overdose crisis. At the beginning of the pandemic, there were 6 or more people dying per day. This was bad before the pandemic. It's only gotten worse under your watch. What needs to change?
Well, this is a good question for my Minister of Health. That's her expertise, and I'll pass it over to the Minister.
Thank you, Premier. You're absolutely right. The mental health and addictions issues are the next crisis that we're going to face once the worst part of COVID is over. We recognize that. We have now, since the beginning of our term, have invested $525 million more into the system to deal with both mental health issues and addiction issues. They're very intertwined. But recently we put over $30 million into working on how we can deal with opioids, substance issues for people, how we can recognize when someone comes into a hospital, for example, if they've had an overdose, how to speak to them then about options for rehabilitation, and then to put the money into those options, whether it's into clinics to help people to help guide them, residential treatment places. We are going to open up 30 more spaces for youth, and we're also investing in more spaces for adults as well, because we know that not every person follows the same path to rehabilitation, so we need to have a variety of options. We've recognized that, and we're putting the money into those services for people.
That's great. Well, before we wrap up, again, I just want to give one more shout out to the people in Wheatley Strong. Folks, we're the most generous group of people anywhere in the world. Please make a small donation to #Wheatley, and they're just incredible, resilient people. We have your backs. We'll always be there for you. Thank you. And again, God bless the people of Wheatley. Thank you, everyone.
Thanks, everyone.
Bon, on va maintenant analyser ces